this is week 2 weekly wrap-up. First off, I want to tell you that I just found out during my very last class that I put you all on hold to go let my dog out, and I forgot to push record again when I came back. So hopefully I can get this done completely undistracted. I'm upstairs trying to hide from my dog, so hopefully they'll leave me alone. So first off, I wanted to say thanks so much for the great discussions that we had during class this week. A couple of things I want to be sure to emphasize, and that is the meaning of SBAR, the meaning of ISBAR, and when we use each format. I think it's important for you to understand, and you'll be asked to actually use these, especially in the clinical setting and in simulation. So other than that, the other thing that we concentrated on, especially in lab, was assessment of mental health. Please be aware that the mental health exam is something that is generally integrated. It's something we perform as we're actually interviewing the patient. We rarely do specifically just a mental health exam. But some of the strategies and some of the tools that are listed in the chapter are things that you can pull out when you need to and perform the different assessments that may be indicated according to what's going on with your patient. So a couple of things I wanted to emphasize is that the reason mental health exam is important is because your physical and mental status are interrelated. And so sometimes a mental health issue can create physical signs and symptoms. One of the things that I think is important is understanding that there is a cultural aspect to the expectations of what would be considered. And you can find that information on page 66 in your textbook. The other thing that I think is important for you to know is that when you're performing a mental health exam and you're asking personal questions, I want to start right out asking these sensitive questions that you may offend the patient by asking. So you want to establish the rapport, and then you want to preface any type of personal question with the rationale for why you're asking. You want to justify those questions because many patients don't understand that if you notice, for example, someone has jaundice, and then the next question is, how much alcohol do you drink? That might be off-putting to some people. Familiar with the different screening tools that were mentioned, and that includes the HITS tool on page 67. And then there was the CAGE and the audit tools and what they're used for and how they're different from one another. The other thing that I wanted to point out is assessing for recreational drug use. According to your text, every adult and adolescent should be asked about this. But remember, you're going to have to kind of figure out in advance the best way to phrase these questions. And again, you're going to wait until you've established rapport. In addition to recreational drug use, you're also going to ask about alcohol use. Okay? Depression is very, very common, and I want you to be familiar with both depression as well as the risk factors for depression. If you decide that someone is depressed, it's important to find out if they have any suicidal ideations. And there is a paragraph that talks about the types of screening questions that you should ask about that. And again, that can be found on page 68. Anxiety is something else we frequently see, either chronic anxiety or anxiety induced by a specific illness. So those signs and symptoms and risk factors are important to know as well. When we talk about altered mental status, sometimes it is acute and sometimes it is chronic. But a change in mental status is something that needs to be assessed. Pages 69 through 70 discuss the different types of questions that we ask to establish whether or not someone is alert and oriented to person, place, and time, or alert and oriented to person, place, time, and situation. Those are documented as ANO times 3 or ANO times 4. So when you're assessing memory or calculation ability, communication skills, judgment and reasoning, or abstract reasoning, you should be able to recognize the types of questions that we generally ask and what we're trying to assess. So those may show up in a test question, and so you should be able to recognize those. Let's see, what else would be a significant thing? The other thing that I think is important is on page 72, and it continues on page 73, and that is health promotion for mental illness, suicide prevention, and interpersonal violence and substance abuse. There's some important information there, and I think that would be something that you would need to refer to. One thing that was not assigned that I want you to take a look at is actually later in the textbook, and it's on page 496, which is part of chapter 24. And you assess that someone is not alert, and you're trying to figure out, well, what do I call this? On page 496, there are different definitions for describing different levels of consciousness. So lethargy, whether or not someone is considered stuporous or just obtunded. What is the difference between semi-comatose and comatose? All of that information, along with the use of the Glasgow Coma Scale, can be found on page 496. And I think you should be familiar with what the Glasgow Coma Scale is, what it's used for, how we assess the level of consciousness or responsiveness based on those parameters that make up the GCS. And I also want you to be familiar with what we call different levels of consciousness when someone's consciousness is altered. One thing I forgot to mention that is also important is understanding what delirium is versus someone who is has dementia. So going back to our mental health chapter, be sure that you understand that. And your book also discusses several common mental health disorders. You should be familiar with those as well, because many of our patients that are in the hospital or that we see in a home health situation have chronic mental health conditions. And so that is sometimes superimposed on a medical problem, and so you need to be familiar with what those things are. So if someone tells you that they have a medical or a mental health issue, and things like, let's say, bipolar disorder, chronic depression, let's see what else, schizophrenia, delirium and dementia, all of those things are important to at least have a baseline understanding of what they are. And those things can be found on pages 75 through 77. Be sure to read through the alterations for the assessment findings and variations related to age. So, for example, on page 75, it talks about how you screen and what types of things you screen for in infants, children, and adolescents compared to older adults. And so that's important information as well. All right, so I hope we made it through the whole thing without any disruptions, and I hope that these weekly wrap-ups are helpful to you, because I know you're learning a lot of information, and the more you can figure out what's important to know, the more successful you're going to be. So, have a good week.